Welcome to my YouTube channel. It's Sister Annabelle Enes from Zambia. If you're a returning subscriber, I said thank you so much for returning to this channel. And if you're a new subscriber, I said thank you so much for subscribing to this channel. And if you're just watching, please don't forget to subscribe. Don't forget to turn on your notification bell so that each time I post the video, you are the first one to see it. Then don't forget to drop comments if you have any questions, and don't forget to like it. Without wasting your time, we are going to begin. Today's topic is hypertension, high blood pressure. Yeah, high blood pressure. So we're going to define high blood pressure. We're going to say the classification, we're going to say the pathophysiology, we're going to say the signs and symptoms of high blood pressure. We're going to do the treatment, then the prevention, then we're going to do the complication. Please, I want you to watch this video up to the end. Watch this video up to the end. So stay tuned. So we begin. What is hypertension? What happens to our body if we are diagnosed with hypertension or high blood pressure? So definition: hypertension is a condition where there is constant elevation of systolic blood pressure above 140 milliliter of mercury and a diastolic blood pressure above 90 millimeters of mercury. Or it is a condition which there is a sustained elevation of arterial blood pressure systolic above 140 millimeters of mercury and diastolic above 90 milliliters of mercury. That is the definition for hypertension. Classification. How do we classify hypertension? So classification, hypertension is classified into two segments, which is the primary segment and the secondary segment. Under the primary segment, primary hypertension caters for 90 to 95% of people, and the cause of this hypertension is unknown. Then this primary hypertension runs in the families. Yes, it runs in the families. So it is further divided into benign hypertension and malignant hypertension. So in benign hypertension, it can be present for a long time and without causing serious problems. With malignant hypertension, it's just a sudden onset of hypertension and it leads to other complications. So those two, benign and the malignant, are under primary hypertension. Remember, it runs in the family, the cause is unknown, and it caters for 90 to 95% of people. Then we have secondary hypertension. In secondary hypertension, it's the cause, it covers 5 to 10% of people, and the cause is due to underlying conditions. So people with DM, people with renal failure, people who are taking birth control pills, people with kidney disease, the obesity ones, pregnancy, and then anxiety and stress, all these can cause secondary hypertension. So secondary is due to other underlying condition. So having said the classification, we're going to do the pathophysiology. So pathophysiology depends on what is causing it. So the two things that I want you to understand in this pathophysiology, that if you remember these two things, I can assure you, if it came in an exam for those who are in school, this will be the easiest way to remember. Just remember to say anything that activates the release of renin in the bloodstream. When renin is released in the bloodstream, it causes, or the conversion of angiotensin 1 to angiotensin 2 with the help of angiotensin converting enzyme. The angiotensin converting enzyme constricts the blood vessels, leading to hypertension. So whether if it's kidney disorder, it will lead to renal ischemia. With the ischemia will activate the release of renin angiotensin system in the system. Then angiotensin will lead to conversion of angiotensin 1 to angiotensin 2 through the help of angiotensin converting enzyme. This will constrict the blood vessels and it will lead to hypertension. That is the pathophysiology. Even if someone, let's say someone is taking control pills, birth control pills, some birth control pills will releases renin. And when renin is in the bloodstream, it will cause the angiotensin 1 to be converted into angiotensin 2. Angiotensin 2 will lead to constriction of blood vessels, leading to hypertension. Literally, that's what happens with hypertension. Risk factors. Who at risk to get this high blood pressure? So, grandpa, age of 80, anyone above 60, anyone above 60 is at risk to get hypertension. Male, yes, male, because of pressure, thinking of where to get money to pay school fees, to pay rentals, to buy food, they are at risk of having blood pressure. Africans, people of color, yes, as people of color, because of, I don't know, maybe poverty, we are at risk of having blood pressure. Then family history of hypertension, just know you are at risk of having blood pressure. History of diabetes, you are at risk of having high blood pressure. Obesity, excessive intake of salt, yes, excessive intake of salt, just know that you are at risk of having blood pressure. Emotional stress, you are stressed, just know that you are at risk of having blood pressure. So, having said the people at risk, let's go of the signs and symptoms. How would you tell to say, this is high blood pressure, this is high blood pressure? So, when someone comes, they will come maybe with headache. So, headache will come in due to hypoxia. Just know that you need to check the blood pressure of that person. So, they will come with a blood pressure above 140 and of systolic and above 90 of diastolic. So maybe 157 over 110. Just know that this is raised blood pressure. So they will come with the dizziness, they will come with shortness of breath, blurred vision due to the rupture of blood vessels supplying the retina. Then they will come in a confused state, yes, maybe due to brain damage. They'll come with the palpitations due to heart overwork. Then they will come with nose bleeding due to the rupture of the vessels. They'll come with tiredness, maybe due to impaired tissue perfusion. They can also come with chest pain, due to anginal pain. Then they can also come with the ear noise, due to the ear involvement. They come with blurred vision, yes. So if the patient come with blurred vision, dizziness, all these signs and symptoms that I've talked about, try to check the blood pressure. You'll find that the blood pressure will be raised, okay? So those are the signs and symptoms. So what do? Let's investigate this patient. So we're going to do, under investigation, we're going to do history taking. Do you have any uncle, any grandpa, maybe your mother, who have hypertension in your family? If they agree, just know that maybe they are falling under primary hypertension. Or if they have any disease, do you have diabetes, are you stressed, are you obese, you see all those things, maybe they'll tell you, just know that they're falling under secondary hypertension. Then you can do blood pressure, which will show, it's a cardinal investigation. You do high blood pressure, which will show blood pressure on the higher side. Then you can do urinalysis to rule out renal disorders. You can also urine function to rule out renal diseases. And then you can also do renal angiography to rule out stenosis. So anything, read like anything to do with renal can cause raised high blood pressure. So treatment. How we treat these people who come with hypertension, we have a lot of drugs that we give, and these drugs that we give with people who come with either secondary hypertension or primary hypertension is, we'll give you alpha blockers, which is methyl-dopa. Yes, we can give you 250 to 500 milligram. Then we can give you angiotensin converting enzyme inhibitor, so that we prevent the angiotensin 1 to convert into angiotensin 2. So we'll give you angiotensin converting enzyme inhibitor, which is enalapril. So we'll give you enalapril 5 to 10 milligram. We can give you a start depending on if you are falling under primary or you are falling under secondary. Then we can also give you beta blockers. We give you beta blockers, which is propranolol. We can give you propranolol 20 to 40 milligram. Then we can give you channel calcium blockers. Channel calcium blockers, which is a very common drug, and this drug is the nifedipine. We can give you nifedipine 20 milligram, maybe BD or OD, that is once daily or twice daily. Then we can also give you moduratic, which is 30 to 60 mils. Yes, we can give you moduratic, which is Lasix or furosemide, 20 to 60 mils. And then we can, 60 milligrams. Then we can also give you vasodilators, so that that constriction which has happened in our pathophysiology, we can try to dilate the blood vessels. So we can give you hydralazine. So we can give you hydralazine 20 milligram, which can be IV or per oral, which is a tablet. Then if you're in pain, we can also give you analgesic. We're not stingy. We can give you analgesic, which is paracetamol, 1 gram, depending on your weight. Yes. Then we can also encourage you, or we encourage people to take enough rest. We encourage people to take enough rest. Then apart from that, we encourage people to restrict from excessive intake of salt. Excessive intake of salt will cause water retention, which will lead to high blood pressure. So restrict some patients to take excessive salt. Prevention, please don't stress. Stress is not good. Don't stress. If you are on medication, take your drugs as prescribed by a physician. Take them daily. If you run out of drugs, come to the hospital and get your drugs. If you like salt too much, please, you can reduce the intake of salt. Try to have enough rest. If you are obese, try to lose some weight. Yes, try to lose some weight. So complications. High blood pressure can cause complications, and some of the complications that it can cause, it's stroke. It can cause stroke, it can cause loss of vision, it can cause CCF, which is congestive heart failure, it can cause blood vessel damage, it can cause brain damage, and it can also cause kidney damage. Yes. So nursing care, your aim is to reduce the raised blood pressure and then educate the patient about his condition, because some patient, maybe it's the first time, they don't even know what is happening, then the blood pressure is high. So you educate the patient about the condition. Then you prevent complications like stroke. So if the patient is stressed and he has a very high blood pressure, try to call some counselors to counsel this patient, because they can even go to acute stroke. It's there, yeah. So then we promote quick recovery. We want you to see you fine and fit. So promote quick recovery. Not every patient deserves a nursing management. So if you want the nursing management, I'm going to post it one of the days to come in one of my videos later on, how to manage a patient in the hospital in general. So please hope you've enjoyed my presentation and hope you've liked what you've heard and learned something. So tell grandma, tell grandpa about hypertension and how to prevent it. From me to you is bye and God bless you. Don't forget to subscribe. Don't forget to turn on your notification bell so that each time I post a video, you're the first one to see. Like it and drop comments if you need any clarification or any help in any ways.